what is the most likely cause of this patient's palpitations? AFib, atrial tachycardia, multifocal atrial tachycardia, paroxysmal supraventricular tachycardia, or macro reentrant atrial tachycardia. 68-year-old man presents with a history of coronary artery disease and heart failure. Oh, with a history of coronary artery disease and heart failure, presenting to the clinic complaining of palpitations for the past 2 days. On exam, his blood pressure is 135 over 85, heart rate's 145, and oxygen saturation is 96 on room air. The patient's ECG reveals an atrial rate of 290 beats per minute and a ventricular rate of 145 beats per minute. The atrial waves show a regular undulating pattern. Okay. So breaking this down one by one, atrial fibrillation is not the right answer because you would see a complete absence of P waves. And we clearly see atrial waves on the EKG. Atrial tachycardia, multifocal atrial um micro multifocal, isn't that like the cause of AFib? I'm gonna come back to that later. Macro reentrance atrial tachycardia, I'm pretty sure describes Wolff Parkinson White, which I don't necessarily think we have here. Um Paroxysmal means that we don't have it all the time, and he's had it pretty consistently for the past 2 days. I'm gonna go with atrial tachycardia.
Final answer.
Yeah.
Okay, so I'm not. Let me make sure this kind of is confusing to me. Let's see, atrial rate is here, ventricle rate, but the atrial waves show a regular undulating pattern. Yeah, I'm not exactly sure if this is the correct answer here, but let me see. Um,
Oh, and that's atrial flutter, not Wolff Parkinson White.
yeah, atrial flutter characterized by regular rapid atrial rate around 300 with a regular response. Perion supraventricular, typically sudden oscillating terminated with a narrow QRS. Yeah, that's fine. Irregular atrial activity with at least 3 different P waves, varying P waves. Atrial tachycardia, usually with a regular ventricular rate. Atrial and atrial are typically distinct and have consistent morphology. These right, a 250, a regular undulating pattern. I have to take a look at this because I cannot remember 100%. I don't know what this regular undulating pattern means. Does that mean exactly what it means, where it's just fibrillating, right? Because that's what atrial fibrillation is.
Oh, yeah.
So I'm pretty sure that's what it means, right? If that's the case, then A is definitely your best answer. And also on top of that, right, your ventricles are not responding to every beat it's missing, right? So it's not correlated. So that makes sense to me. So the best answer might be atrial fibrillation here because they're talking about like the actual muscle waves, right? They're not talking about the ECG waves, which is the P wave that you're talking about, which is almost absent. They're like absent P waves, right? Is atrial fibrillation, right? Irregularly irregular, right? But this is actually talking about the muscles that are kind of
Uh,
fibrillating. So
okay.
if that makes sense.
Yeah, that does make sense.
Yeah. So it's the way that, in a sense, right? It's the way that it's worded is a little bit weird because they don't really kind of, mention PT waves or QRS waves. They just give you the rate of one and the rate of another. And then they say this atrial wave, which is more of like, I think it's like a probe inside the atria, and you kind of see how like it kind of flutters or fibrillates. So that's what they're trying to go for here. Kind of more of a complex question for sure.